Gabriel, then talking about the other reforms that the president touted yesterday was what's needed in the healthcare reform, which is very key for as a driver of the country's progress. Kenya is an exporter of human resource.
Correct.
And that's very evident, and that their input is felt across the continent and the world. But then how does the government justify then when you want to roll out universal healthcare coverage and more than 50% of the public service in the country are insured by private firms, for example, instead of NHIF?
Well, that has always been a serious thorn in the flesh. And if there's one thing I know for sure, that the current administration has burnt the midnight oil doing is to ensure that the nation is healthy. Now, Ayub, you know there's something we can't run away from, and that is how healthcare and our education are tied in. Because as you saw some time back, we saw countries from Europe, let me call them, the Western countries, looking actually inward in Kenya to try and find health workers during COVID. You saw they came recruiting, and that got me thinking, why? It is because, albeit the fact that we think there's so much that we need to do in our education sector, which is true that we must, there's also something that suffices, that we have what other nations are looking for in terms of education. Yes, we are trying to re-engineer this education, but we know it is also a backbone in which most of our health sector is actually paved. And so here we are looking at how we ensure an entire nation, for our workforce, for our labor to be realized. Not only must we be healthy, but we also must ensure that institutions that are offering that particular health are able to provide the services that when you go with your NHIF card, you're able to be treated. I saw last week, I was reading somewhere where many people are complaining that now they cannot use their NHIF card. Now, let me tell you something. These issues did not happen with this administration. Anytime you find there's an element of degradation, whether you look at it economically or otherwise, it actually shows you that there has been a serious and sometimes deliberate, so to speak, effort where you degrade such an environment. And it can happen in so many ways. But key among them is that there are policies that are not being followed. A, or B, there is corruption within that particular entity. Okay. And so you end up in an environment that is not really geared toward ensuring that the common mwananchi is able to get a service, given that they have been contributing sacrificially to a cause. And so it sometimes pushes us back to a very unfortunate situation where a Kenyan is able to go to a health facility and they cannot get the service that they need.
Yeah, yet they paid for it.
Yet they paid for it. And these are now the hard questions that I told you about. This is a situation that a leader must subject himself to a deliberate attempt to emphasize that such situations and such environment must work as they are supposed to. Key in my submission, you saw what happened at KEMSA.
Yeah.
We were here, all of us. If you look at that situation a few years back, KEMSA was mentioned in serious problems, but we didn't hear any heads rolling. Really, it was left as it was. Okay. People who are close to that administration were mentioned, but nothing happened. This time round, when an entire procurement process was bungled, we saw people leave, including very senior
government officials.
Okay. So, to me, that is what I would like to see. If there is an issue in a particular department in government, I like the very fact that the president has said he takes personal responsibility. Okay. Music to my ears. So, if this is the issue we're talking about NHIF, where Kenyans who have been contributing sacrificially are able to go to a health facility and they cannot get the service that they require, heads must roll, Ayub.